Our greatest asset here at UI Healthcare is our people. We have wonderful people working here every day, and we are so very proud of that. A major part of our academic mission is to help our people achieve their highest potential. We believe that one mechanism to do this is through the Executive Leadership Academy. We provide the participants with the skills and tools they need to develop a team, lead change, and to think and plan strategically. We then have them define and successfully complete a project using project management skills. In addition, we talk about how we as leaders of a healthcare center need to focus on quality and patient safety, patient and employee satisfaction and engagement, and basic finance. We are so excited about the ELA and believe that it will be successful because we take leaders from throughout the institution and bring them together where they can make new relationships, then build on those relationships in the future. In addition, we purposefully built the curriculum around the completion of a project that the applicant has chosen. So at the end of the course, the applicant will have a project that will benefit both them, our patients, and the institution as a whole. Throughout the course, the participants have access to a mentor or coach and to resources they need to complete the project. Don't be mistaken, they work very hard, but at the completion of the program, their opportunities as leaders are endless. Here are a few words from our soon-to-be ELA graduates.
The Executive Leadership Academy is a program that I wanted to get involved with because it gave me exposure to several other disciplines. It gave me exposure to many other aspects of University of Iowa healthcare and really got me at a higher level, a more global level, where I could see how things were done, how things could be accomplished, and how I could be a better leader. It's really nice that the Executive Leadership Academy provides you with leadership coaching as well as a coach for your project. So once you get in there and you start learning about different aspects of the organization, you start getting exposed to resources that maybe you didn't know existed, and you're able to apply those things to your project. As we go through the project process and as we learn more information, we're able to apply that and have our projects be more successful. It is an experience that is worth having. The network of people that you meet, the content that you learn about, and the project that you complete all benefits you at the end. It makes you a better leader for your unit, for the organization, for everything.
Outreach is a service that provides care to specialists around the state of Iowa. We have over 100 clinics, and we service over 40 communities. This really was quite important for me. I've been at the university for quite a few years. I did my training here, and for many years I wanted to be more involved in leadership at the university. I really felt like I wanted to give back to the hospital, and I took on some roles over the years as director for clinical outreach, and I wanted to make sure I did that effectively. It was important for me to do it right. This was an amazing opportunity. I saw what the agenda was in the series, that there were coaches involved in this to help us through, and that it was just an amazing group of individuals who were participating and speaking, and that really has already helped me in identifying individuals to contact and network with, and it's given me the confidence to go to different parts of the hospital and ask for help. I mean, there's a lot of times I always say I need help wherever I can get it, and people say you need all the help you can get, and I'll go and I'll track down those individuals.
In terms of why I actually decided to join the Executive Leadership Academy, I think broadly put, probably to expand my skill set. I've been in practice for about 10 years. We learn about how to be a doctor, how to be a surgeon. I've also been running a research lab, and over time acquired these leadership roles without any sort of formal training. So for me, it was a way to, get a sense of what I was actually, what I had been doing day to day, but put it in a more formal framework and see if this was something I wanted to pursue as a potential career path. I'm getting many things out of the Leadership Academy. The key couple of things that come to mind are, one, realizing that even though we kind of work in this big institution in seeming silos at times, whether we're doctors, nurses, already have leadership roles, work in central sterilizing, etc., certain key problems and issues are common, and solutions to those are common. And then stemming from that is the fact that I think the biggest asset to this Executive Leadership Academy has been to be able to interact with people from all these various disciplines, the people that we've gotten to meet, both in leadership positions as well as in other departments, and realizing that we actually have similar issues to deal with.
From a faculty standpoint, I believe the benefits of going through the ELA are several. The first would be having the opportunity to learn more about what is a very complex organization when generally you have your head down in your own particular area. I believe the second is the opportunity to meet people who perform alternative functions within the organization whom you might never otherwise have an opportunity to speak to or learn about. And finally, it really is an opportunity to think broadly in the institution. It provides you with an opportunity to impact what is happening in the institution and the ability to perhaps produce change that is beneficial for the institution.
The Executive Leadership Academy, the purpose was to take emerging leaders, people in positions that might not typically be considered leadership positions, but really to work with them and to develop them, to help them realize their potential and the potential contribution they can make to UI healthcare across all divisions, not only the hospital, but all entities within the triumvirate, which include the Carver College, the UI Physicians Group, as well as the UI hospitals and clinics. One of the most interesting, I think, benefits of the program that I've seen as I've been around the participants both in the environment and outside is the ability to network across disciplines. And I've seen on many occasions people who have developed collegial and professional relationships that might not otherwise have ever met. And not only do they develop the relationships through this bonding experience of being educated together in kind of a didactic curriculum sort of way, but also in a professional manner, and they call on each other in their professional roles, which it can only enhance the way that we do business as an organization. So you've just heard from a few recent graduates of the Executive Leadership Academy, and I hope that you share the same excitement about the program as we do. It's an extremely competitive program, and of course, you'll need your supervisor's recommendation during the application process. But if you think this is for you, we encourage you to apply. If you think you're ready for the next step, if you think you have what it takes to be an emerging leader, then we definitely want to make this investment in you. So please apply for the program. All you have to do is either go to the point or the loop for further details. I hope to see you there.
University of Iowa Healthcare. Changing medicine, changing lives.